the role of obesity as a gateway for many other chronic diseases. We have more than 200 complications or medical conditions related to obesity, including important one because obesity, in particular abdominal obesity, is a risk factor for cardiovascular disease, for heart failure in particular, but also it is a risk factor, of course, for type 2 diabetes and other cardiometabolic diseases.
Luca, why don't we start with the general discussion of you with your really long-standing interest of obesity? Why is really obesity an important issue for every medicine kind of active person? And why should it also be for politicians an important issue?
Yes, this is a real problem. Obesity has been recognized as a chronic disease in the recent year. And we know very well now that obesity is a disease itself because it causes physical symptoms, reduction in physical performance to our patients, but also we recognize very well the role of obesity as a gateway for many other chronic diseases. We have more than 200 complications or medical conditions related to obesity, including important one because obesity, in particular abdominal obesity, is a risk factor for cardiovascular disease, for heart failure in particular, but also it is a risk factor, of course, for type 2 diabetes and other cardiometabolic diseases. We are increasing data demonstrating that obesity is a risk factor for chronic kidney disease, even without the development of type 2 diabetes, because there is a obesity-related nephropathy that can develop to severe stages of the diseases. And we have the problem with the fertility and endocrinological problem, knee and hip osteoarthritis, sleep apnea syndrome. We have several types of cancer related to obesity. So obesity, given the epidemic of obesity that we have now, is receiving much more attention by the public, by the healthcare professional, and also, I hope, by the healthcare systems, because in many countries, including Italy, the level of care that our national health system provides to people with obesity is less precise and less important than the level of care the same system provides for other chronic diseases. This is the reason why it is important. The real new is that now we have much more drugs for treating effectively this disease. And this is, in my opinion, increase the importance of the recognition of the disease because we can do better than in the past for our patients.
Now, with this discussion, I would love us to structure it a little bit and maybe start initially discussing about the definition and the recognition and the diagnostic tools and the maybe even different types of obesity, move to the pathophysiology, and then really spend the second half of the discussion on the treatment and the various issues around this, maybe if that's okay with you. So let's start. I think you have good and very comprehensive views on how best to diagnose. I mean, the easiest thing is you see that a person is obese, and okay, that's easy. Maybe then it's already gross obesity. But how is really the best definition, and what are people to really understand about the definition of obesity?
The definition of obesity is excessive or abnormal fat accumulation. And this is important to understand how to define excessive or abnormal. Normally in the clinics, we use the body mass index. The body mass index is a very crude epidemiological measurement. It has been used for epidemiology studies. There is a relationship between body fat and fat accumulation. Of course, if the body mass index is high, we have very few doubts about the diagnosis of excessive fat accumulation. But there is a range of patients in which the body mass index can be low but misleading. In particular, in patients with low fat-free mass and high fat mass, what we call sarcopenic obesity, that is very frequent in patients, in elderly patients, but also in younger patients with chronic diseases. And in the case, the clinical significance of BMI could be less clear, and we need maybe to use much more sophisticated method for measuring body composition. On the other side, the most important thing that need to be stressed, and we stress this point in particular in our recent publication, the IESO new framework for the diagnosis of obesity, we stress the importance of fat distribution, because many of the clinical consequences of obesity, including the cardiometabolic and nephrometabolic consequences, are much more driven by the abdominal fat accumulation than the absolute level of fat accumulation in the body. So it is really important to stress that, in particular in people with the low BMI, even in the overweight range, to have a very high waist circumference or waist to high ratio is an important risk factor for developing cardiometabolic complications.
Luca, if I can jump in, one or two things, just really as a stepwise approach for our audience. Still, yes, body mass index is not perfect, but as you say, a high body mass index essentially never comes without excess adiposity. So let's say above 35, we can always be certain there's obesity, right?
Yeah, we can agree.
Now, what about below 27? Because there's not a single clinical trial at this stage doing weight loss therapy for anybody with a BMI below 27. Could we essentially, for the time being, forget about patients or people below 27 BMI, and where there really we need more precise assessment, where BMI alone doesn't tell us too much, is between 27 and 35? Would you say that's fair?
But even 25 to 35. So
okay, in particular in Asian people, this is a global conference.
No, because it's a matter of fact that the cardiovascular risk is much more driven by abdominal fat accumulation. So we strongly advise that the clinical therapeutic decision about weight loss or prevention of cardiometabolic risk should be based on fat distribution much more than the fat accumulation per se, because you can have patients with relatively high BMI, but very good fat distribution, not adipose tissue-based chronic disease, that they are metabolically normal and they can stay there, and that they can also survive without progressing to metabolic event, at least for some time. Yeah. But in people with overweight and high waist circumference, the risk is higher as in people with 35 of BMI. So in our opinion, in the opinion of the IESO, the importance of addressing overweight or mild obesity when it is located at the abdominal level is completely underway. So we are a lot of under treatment.
Yeah, I got it. So I think this is important for our audience, but how's the easiest way to really measure this in the clinical practice? Because DEXA scanning, CT scanning that's far too complicated for the most patients. How are we best addressing this in everyday practice?
You need to distinguish which is your aim. If your aim is measuring fat mass, you need to use instrumental techniques. The most simple one is bioelectrical impedance analysis, of course, with the limits that we know about the methodology. But here, the most important thing is not to measure fat or fat mass. It's to measure where the fat mass is accumulating. And in our in the clinics, the best method at the moment is anthropometry and measuring the waist circumference.
Just you emphasize waist circumference, so no longer waist-hip ratio?
The waist-hip ratio can add some additional information, but it required two measurements, is a ratio. Usually doctors, including myself, do not work very well with ratio. The interpretation of the ratio is a bit complicated in our mind, in my opinion. So,
but the waist circumference, I guess, what are the easy cut points for people to remember, maybe for women and for men separately?
For the waist, the absolute level of the waist circumference, there are different cutoff value for the two different genders, and there are also ethnic cutoff value. This is the reason why we suggest to use the waist to high ratio, the ratio in between your waist circumference and your height. And if the ratio is over 0.5, when your waist circumference is more than half your height, you are at risk.
If you have comments or questions, please post them in the comment box. Our experts will reply, and the channel secretariat will share their feedback. You may watch other key message videos by clicking the link in the description box below.